Hello, I'm Dr. Gayathri Perera and I'm a consultant dermatologist. One of my special interests is inflammatory skin disease, and today I wanted to discuss acne. That's one of the most common conditions I get asked about, from teenagers all the way through to middle-aged people. One of the driving forces of acne is testosterone, and that is why puberty sees more acne than any other time. However, acne is quite a short-lived disease. Its consequences can, however, be very long-term, and that's one of the reasons for seeking help quite early on. So if you're at all worried about spots, whether they be on your face, your chin, the back, or the chest, it's to get an early consultation with your GP. Now, your GP is able to prescribe you quite a few topical treatments and even prescribe you oral antibiotics. And it's a conversation you need to have with him to see what you need. If, however, at that time your GP feels you need a more specialist opinion, then he will refer you on to a dermatologist. Now, one of the most common myths about acne is that it's diet-related. In fact, there is no medical evidence to suggest that diet contributes towards acne. What we do know is that your sebaceous glands, the oil glands in your skin, are influenced by testosterone, and that makes your skin very oily, prone to clogging, and then there's bacteria that gets trapped. So if you really think about it, there are lots of different ways in which acne manifests itself, and we have to try and treat it at the very different levels of your skin. So the topical treatments really are to do with trying to unblock the clogged pores, try and tackle the bacteria that are actually trapped in those blocked pores, and the antibiotics also help the inflammation, the redness that you get associated with your acne. Now, that's the topical treatments, but you can also have oral treatments, and the majority of treatments that you take orally are antibiotics, and it's really trying to find the best antibiotic that suits you. I would say, in average, the first 2 months of taking an antibiotic, it's the antibacterial effect that you're feeling. But you will be surprised that dermatologists will keep you on for antibiotics for much longer, sometimes 6 to 8 months. And that is for what we call the anti-inflammatory effect, the anti-redness effect that you would feel. We always combine it with a topical treatment, and the two together work very nicely. Another trick up our sleeve is to connect and really try and correct all the testosterone levels in your body by putting female patients on the pill. And that tries to regulate the amount of testosterone that is being released. That normally is sufficient to try and control the acne. If, however, things get out of control and you're getting quite deep scarring acne, then sometimes we will bypass all the antibiotics and go straight for something called Roaccutane. Now, there are lots of lobby groups out there about the pro-Roaccutane group and the anti-Roaccutane group. The most important thing is that you're informed, and the best conversation to have is with a dermatologist about Roaccutane. Only dermatologists can prescribe you Roaccutane under very strict supervision. So it's a very safe drug if given and controlled properly. So what I would advise you is, if any of these issues are concerning you, or you're worried about scarring, then I go to your GP and get referred to a specialist.